with the excess death thing, it creates a very difficult problem because you need baseline data. And your baseline data needs to be representative, it needs to be done systematically, it needs to be validated. We don't do a good job at that here. I mean, I read a study, a very interesting study about why we also care about that, that looked at the recorded causes of death by, like for people who are brought in dead or, are dead on arrival. At Cape Coast Hospital, the reported causes of death in the coroner's investigations after the few cases. And you find that if you look at the coroner's investigation and look at causes of death there, it's a different top 5 from if you look at the actual hospital reports and what the top 5 are. So we know that even in a place like Cape Coast, very small population or relatively small population, even there the data doesn't match up between coroners and between the actual healthcare providers or Ghana Health Service. So the kind of baseline, the problems with the baseline data are pretty large. So to do an excess mortality study, you would need to make quite a few adjustments and assumptions about what the baseline is and whether or not it's representative. And I worry with a study like that, the kind of transformations that's required for just the baseline data, it creates like a lot of systematic error going forward if you get that wrong. So it's a difficult study to do here for sure. But I do think that we have people like Professor Bedu Akosa who are expert epidemiologists. We have people like Fred Vinker who are expert epidemiologists who we should be talking to, who can figure out ways to think about this in an empirical sense and can work with people who are working with new methods and new models and other things, figure out ways to actually turn that into proper investigation. But the circle of people who have to be involved in those things has to be much bigger than this now. And if we're going to do that, I mean, 2020 lost opportunity. So 2021, what can we do now? And if in 2020, because of, like Dr. Sanders said, many of the health system pressures, we were also then not getting good data because people weren't showing up and weren't doing autopsies and all that stuff. Then obviously, 2021 will have the same problem with a bad baseline in 2020. So it's a difficult one, but it's something that it would be very critical information to know because, like I said, South Africa did theirs and found out that the mortality was double what they thought it was. Russia did theirs and recognized that it was 3 times what it was. And in those countries, that's actually picking up not just, it picks up some marginal addition to the people who are dead that you don't know from COVID. But what you're also picking up there, like Dr. Sanders was saying, is people who are delaying care because with a heart condition, kidney disease, liver disease, who are then coming in critically ill in the ER and other things, and unfortunately passing at home. Those people are also being picked up in excess mortality studies. So as to what that would be in Ghana, where we already have bad baseline data collection, it's really hard to tell. But I would imagine if we did an excess mortality study, I mean, we would be in for a very rude awakening as to whether or not it is the case that, under 400 people have died of COVID-19 over the last almost 300 days.